Hi there, I'm Marnie Clark, and welcome to my massage room. I'm a massage therapist. Back in 2004, though, I had breast cancer and I had a lumpectomy, followed by a Latissimus dorsi flap surgery, where they take a piece of your back muscle and bring it around the front to recreate a breast for you. I started to have a few problems with that, and from the surgical scar, and I noticed that there's more than a few of you who are having the same problems. So I wanted to share with you today what it was I did that helped me through it so much. It's a massage technique called skin rolling, and I'll demonstrate that for you in just a moment. Skin rolling helps to, I'll show you the sort of technique where you're just rolling skin up the back, especially over the scar. The problem being that the scar tissue sometimes adheres to the underlying structures, and so when you go to raise your arm or move a certain way, it causes a problem, hurts. So here's what alleviated that for me. I had this particular technique done for me, and I had my therapist use a combination of wintergreen oil and peppermint oil, essential oils these are, and the wintergreen helps with pain and the peppermint helps with inflammation. And sprinkle them on the back. I'll show you how I do that in just a minute, and it really does make a huge difference. I felt so much better after doing this just a few times. So I hope that helps you. I have a website called marnieclark.com, and I started this website to help women who are going through breast cancer and men. And it's my pleasure to walk with you through this journey. And if I can help you at all, that's why I'm here. Okay? We'll meet you back here in a minute at the massage table. Okay, so we're going to show you the skin rolling technique to help loosen up. Pretend there's a scar from here to here. We're going to help loosen up the scar tissue and any adhesions that might be forming in this area after you've had the Latissimus dorsi flap procedure for breast cancer, breast reconstruction. This is my friend Robin. Thank you, Robin, for agreeing to do this today. What you want to do is you're starting pretty low, down by the waist, and you're grabbing a small portion of skin and until it's like the size of a hot dog maybe. So see how I'm holding it on either side, and you're just walking these fingers up the back while the thumbs push the roll of skin up the back. And if you want to, you can pick it up gently, especially when it starts to loosen, in the area where it starts to loosen up a little bit. Pick it up gently. As you approach the area of the scar, it might be tender for the person, so be really careful about that. Just go slow. If you need to pause like this and just let things release, do that. And we just keep rolling right up to the point where it gets tight and you can't go any further. I've already done a couple of practice runs, so you can see that Robin's skin has turned nice and pink. And that's just the increased circulation, which is exactly what you want. So we're just going to go up, do this a few times. You'll feel silly about it at first, but then as you do it, it will be more comfortable for you and for the person you're doing it for. But it really does help so much, because scar tissue and adhesions can form with these newly created surgical incisions on your back, and I know a lot of people are having a lot of trouble with that, so this helped me quite a bit. I had my friend in Australia do this, and now Robin does it for me now too. She's a massage therapist as well, and she does this for me. Even 8 years later, I still find that it needs to be done. So after you've done that a few times, then you want to use some nice essential oils. Wintergreen is one that I use, and it's good for pain relief. So we're just going to drip that into the skin and just rub it in. I use wintergreen and peppermint. Wintergreen, as I say, is good for pain relief. It's like liquid aspirin. It's what It's what aspirin was actually based on, the chemical structure of wintergreen oil. Alright, then I'm going to layer on some peppermint. And it doesn't matter which order you put them on in. Peppermint's good for inflammation and also pain. For those of you who are doing this, it's good to keep your wrists and your hands lined up. That way you don't injure yourself. You can also use your knuckles, which goes a little deeper. So if you're going to do anything deep, just remember to go slow. Wait until you feel the tissues release. And that's about all there is to it. This helps loosen up the area. Helps get rid of those adhesions. And that's it. Thanks for watching.